What drove you to look deeper into this topic?
We basically are trying to give a face to in Washington State to what are the consequences of having cannabis so much more available and so much stronger.
Dr. Bia Carlini is a professor at UW Medicine's psychiatry department, where she directs the cannabis education and research program.
It seems like some people will claim they're having way more fun, which nobody's here to dispute, but we also want to see what is happening in terms of burden.
She's referring to the burden on healthcare providers who are noticing something concerning. Her findings on the health consequences of cannabis use were recently published in the Substance Use and Addiction Journal that found some eye-opening results. In a survey of 388 doctors and clinicians in Washington state, 35% reported seeing patients about cannabis-related problems at least 2 to 3 times a month. 70% of the clinicians reported treating patients who experienced severe vomiting and nausea related to cannabis use, and 53% said they saw patients with psychoses and hallucinations linked to cannabis, with many observing this as the most serious adverse effect.
Interesting that the three things they are seeing the most are exactly the things that weren't commonly seen before legalization. 10 years ago, nobody were talking that much about people having terrible cycles of vomiting and nausea and pain.
In Washington, recreational pot became legal in 2012 and retail sales began in 2014. Since then, Carlini notes the risks associated with cannabis use are increasing due to higher potency and more frequent use.
Cannabis has changed so much from a plant that was used as a joint. You have now these very powerful concentrates where you went to, 70% of THC.
So now what? Dr. Carlini hopes her research leads to more awareness and training for healthcare providers to treat cannabis-related health issues, and hopes it advocates for more research and medication to treat such conditions.
We didn't do any wrong on legalizing cannabis, but we did not perceive some of the effects that would come down the road of what happened.
For HealthLink, I'm Christine Pei.